Another name for clavicle, it is the collarbone. It is also called as the collarbone, the collar of the shirt, the collarbone. So, before getting into the the details or the features of the clavicle, so first let's learn about some of the peculiar. It's a long bone, right? It's a long bone. So even though it is a long bone, it is having some peculiar features. That means it is having some special features. Peculiar means what? Awkward, something else rather other than common. Okay. So all the long bones in the body, they behave some other way, and the clavicle behaves in the other way. That means a peculiar feature or a special feature of the clavicle when you compare this long bone with the other long bones in the body. Okay. So the special features or the peculiar features of the clavicle are: number one, as I said, it's a long bone. It is the only long bone in the body, which is situated horizontally. Am I clear? It's the only long bone which is situated horizontally. Other long bones in the body, they are situated longitudinally. It's the only long bone which is situated horizontally. Number one point. Number two, you all know all the long bones, what do they contain? When you cut the bone, long bone, inside there is a cavity, right? Yes. That cavity is called as medullary cavity. What is it called as? Medullary cavity, where you have either the red bone marrow or the yellow bone marrow, right? So, but even though the clavicle is a long bone, it doesn't have a medullary cavity. This is the second point. So, second peculiar feature of the clavicle. What is that? No medullary cavity. As this bone lies, almost all part of the bone, it lies superficial. That means subcutaneous, just below the skin. You can feel the whole length of the clavicle in your own body. You can feel it, right? So whole length of the clavicle can be felt. So it lies just below the skin. It is subcutaneous. Sometimes it can be pierced by the cutaneous nerves. No long bone in the body is pierced by cutaneous nerves. Okay, they are all supplied by the deep nerves. So all the long bones, they are present deep. So this is the one bone which is pierced by the cutaneous nerve. That is the third point. So this is the one again which is a deviation from the laws of ossification. What is ossification? Formation of the bone from cartilage, right? Yes. So it is the first bone in the body to show the signs of ossification. Am I clear? The first bone to show the signs of ossification and the last bone to complete the ossification in the body. So usually what happens, you do know the laws of ossification? Laws of ossification, what are they? The center which appears early, maybe primary or second, it completes the ossification or fuses with the secondary center or rest of the bone early. Which appears early, fuses early, right? Which appears late, fuses late. But here what happens? It appears first, but fuses late. So this is the one deviation from the laws of ossification. It's the one peculiar feature of the clavicle. So these are some of the peculiar features of the clavicle you should keep in mind. Maybe an MCQ or ACQ or something like that. Okay, or maybe an OSP. They may keep this bone and they may ask you to write any 2 or 3 peculiar features of the bone. So what are the peculiar features? I repeat, number one, only long bone situated horizontally, no medullary cavity, pierced by subcutaneous nerves, first bone to show the signs of ossification, and the last bone to complete the ossification. Am I clear? This is about the clavicle. So now come to its general features. So it's a long bone situated horizontally. Okay, so this almost, when you look it from upper side, it looks like the alphabet S, right? It looks like the alphabet S, English alphabet S, right? So S-shaped bone having 2 ends, a rounded, a tubular medial end. Follow my words and keep them in your mind. Rounded, a tubular medial end, and flatted lateral end. Okay, and the medial half of the bone is convex forwards, right? convex forwards. Lateral half of the bone is concave forwards. Concave forwards. Superior surface is smooth. Inferior surface is rough. So these 3 points are very important to know whether the clavicle is of the right side or left side. What are they? Number 1, tubular, medial end, flat, lateral end, medial half convex forwards, lateral half concave forwards. Superior surface smooth, inferior surface rough. These 3 points, keep in mind, okay? So they will keep the bone in the RSP. Identify the bone and write which side it belongs. So how do you identify whether it belongs to right or left? So suppose this is the bone which belongs to left side, okay, left clavicle. If you hold it on the right side, it cannot be right. Why? Because the medial end becomes flat, lateral end becomes round. So that is negative, okay? And the medial half is concave forwards, negative. It should be convex forwards. So all those points, okay? Even though if you hold like this, all the points are agreed. Medial half rounded and it is convex forwards, lateral concave forwards, lateral and flat. But here the superior surface is rough. It cannot be. So it should be smooth. So it has to be left side. So that's how you should identify that the clavicle is of the right or left side. These 3 points. Am I clear? Okay. So now medial half round and tubular, lateral half flat. Okay. So the medial end of the clavicle shows a big articular surface. Okay. This articular surface which articulates with the sternum, which just recollect yesterday's skeleton, which articulates with the sternum to form sternoclavicular joint. Sternoclavicular joint, a very important joint. As I said, it is the only joint which connects upper limb with the axial skeleton. Okay, the sternoclavicular joint. Okay, the lateral end shows again a facet. Can you see this? Look at the bone, why you are holding it. So lateral end also, or also called as the acromial end, also shows a facet. Okay, so that facet articulates with the acromion process of the scapula. Acromion process of the scapula. So this is the left side, right? So this is a left one. Okay. So left clavicle. The articulation is like this. See this? Okay. Acromial end, acromion process to form acromioclavicular joint. Acromioclavicular joint. Similarly, the medial end is also called as the sternal end. This is the sternal end, this is the acromial end. Sternal end articulates with the sternum to form the sternoclavicular joint. So 2 joints. And now come to the superior surface. As I said, it is smooth and much of it is subcutaneous. It is just below the skin where you can feel it. Whereas inferior surface is rough and even it shows a groove under surface. Can you find it? Where is the bone? Yeah. So give it to them. So under surface there is a groove that is called as subclavian groove. What is it called as? Subclavian groove, where you have the insertion of which muscle? Yeah. Deltoid here, subclavian groove. Which muscle inserts? Which is there below the clavicle? Subclavius. The name only indicates subclavius means below the clavicle. Okay. So subclavian groove will have the insertion of subclavius. Along with that, even it shows 2 tubercles. Can you find it? On the inferior surface, there are 2 tubercles. Okay. So these 2 tubercles. Okay. So they are called as conoid and trapezoid tubercles. Conoid and trapezoid. Towards the lateral end, it shows 2 tubercles. One here and one here. Conoid and trapezoid tubercles. So they will give the attachment for same name ligaments. Conoid and trapezoid ligaments. Conoid and trapezoid ligaments. Am I clear? Conoid and trapezoid ligaments. And the other part of the inferior surface, as it is rough, see here towards the medial end it is rough, right? Inferior surface. Look at the bone. Okay, medial end inferior surface is rough because you have the attachment of again the ligaments like between the first rib and the clavicle. Okay, that is the costoclavicular and costo or sternoclavicular ligaments. Between the first rib and the clavicle, costoclavicular ligaments, and between the sternum and the clavicle, sternoclavicular ligaments. Okay, and similarly from here, from the acromial end, acromioclavicular ligaments. Acromioclavicular ligament. Am I clear? Yes. So very importantly is two ligaments, conoid and trapezoid. Conoid and trapezoid. Conoid and trapezoid ligaments. So you can see it here. Here is shown one tubercle, that is conoid tubercle. Trapezoid is missing. Okay. So that's what I was talking about. So now coming to the muscle attachments. Coming to the muscle attachments. So you already studied those muscles. Shall I repeat them again? So what are they? Medial hinge, medial half. What muscles? Pectoralis major. Posteriorly? Here. Sternocleidomastoid. Sternocleidomastoid. Laterally? Deltoid and trapezius. Deltoid and trapezius. Deltoid and trapezius. Under surface, subclavius. This is in brief about the muscles attached over to the clavicle. Clavicle. What are they? Pectoralis major, then sternocleidomastoid, deltoid, trapezius. Deltoid, trapezius. Under surface, subclavius. Okay? Yeah, remember 5. That's it. I think that's it. They are the 5. That's it. Okay, that is the muscle attachments over the clavicle. Okay. So medial half, pectoralis major and sternocleidomastoid. Lateral half, deltoid and trapezius. That is what's shown there. So subclavian group for subclavius muscle. Okay. So this is one of the, see here, this girl had absence of clavicles. How difficult she might be facing. So she cannot move the limbs properly, okay, only through the muscles she is connected. So all the two shoulders can be brought together. She can touch the tips of both the shoulders. Congenital absence of clavicles. So and clavicle fractures are also a little common, especially falling on outstretched hand. You will be sitting and then suddenly you fall. So when you are falling, you will usually put your limb, okay, and whole weight of your body falls on the limb. So then limb is carried through the clavicle. So then clavicle breaks. The fractures of the clavicle. Fractures of the clavicle are also very common. And the mode of injury usually will be like this. See, he will be falling on his left hand. So definitely all the body weight, only one limb. So it gets compressed and then there is fracture. So the clavicle fractures are also little common. And even so when you hit with the shoulder like this, okay, then also there is compression and then there may be fracture of the clavicle. So now coming to the scapula, the second bone of the pectoral girdle, the scapula. Just give it back. So I said it's a triangular flat bone. So this looks like a blade, right? So that's why this bone is also called as shoulder blade. What is the other name for scapula? It is the shoulder blade. We say shoulder blade. So triangular shape. Now the features. It is as it is situated over the posterior wall of the thorax, right? Or the rib cage, extending from second to seventh rib. What is the extension? Second to seventh rib. Second to seventh rib. So having different features like this surface which is related closely with the ribs, this is called as the costal surface. What is this called as? Costal surface. And then This is called as the dorsal surface. As it is posterior, it is called as dorsal surface. Okay, and it is triangular, so having angles: inferior angle, superior angle, and the lateral angle. Okay, lateral, superior, inferior, and three borders: lateral border, medial border, upper border. Am I clear? Upper border, medial border, lateral border. Okay, inferior angle, superior angle, lateral angle. And now coming to the surfaces, the dorsal surface, there is a very big prominent structure or projection from the dorsal surface, that is called as the spine of the scapula. What is called as spine of the scapula, which extends from the medial border and runs laterally. As it is running laterally, it flattens, it widens, you can say, okay, forming a process called as acromion process. What is this called as? Acromion process. Acromion process from the spine. Okay, this spine is having an upper border and a lower border. Observe there in the bone. The spine is having an upper border and a lower border. Am I clear?
Yes.
Where is the scapula? Yeah, it's having an upper border which is sharp and a lower border. Okay, and then the acromion process. Acromion process shows a reciprocal facet. Acromion process shows a facet. Same facet over the clavicle, lateral end of the clavicle, to form acromioclavicular joint. Okay, and now the lateral angle shows a pear-shaped. Am I right? It's a pear-shaped. Pear-shaped cavity which is not so deep compared with your hip bone acetabulum. It's very deep. Okay, so that is called as glenoid cavity. What is it called as? Glenoid. See here, this part. What is this? Glenoid cavity, with which you have the articulation of the head of the humerus to form shoulder joint. To form shoulder joint are also called as glenohumeral joint. Glenohumeral, glenoid cavity and the humerus. Glenohumeral or the shoulder joint. Okay, and from the upper part of this glenoid cavity, you have a bent finger-like projection, or like a, you can say, a beak of a bird. You know, this bent finger-like projection. This is called as coracoid process. I explained it in the last lecture. What is this? Coracoid process. Yes, C-O-R-A-C-O-I-D. Coracoid process. Coracoid process. So these are the features. And one more thing, the upper border near the root of the coracoid process shows a notch. Can you see that?
Wait.
This notch. That is called as suprascapular notch. What is that? Suprascapular notch. Suprascapular notch. Okay. So now, there are two tubercles, one above the glenoid cavity and one below the glenoid cavity. Is it there or not? One above the glenoid cavity and one below the glenoid cavity. Supra and infraglenoid tubercles. Supraglenoid tubercle, infraglenoid tubercle. So now I will repeat the features. Costal surface, dorsal surface. Triangular in nature, so three angles: inferior angle, superior angle, a lateral angle. Okay, and then borders: a medial border, a lateral border, a superior border. Okay, so now the dorsal surface, you have the spine which extends from the medial border, extends laterally, and then it flattens to form acromial process. Acromial process on the medial aspect shows a facet for the clavicle, forming acroclavicular joint, acromioclavicular joint. Okay, and now from the lateral angle, at the lateral angle you have a pear-shaped cavity, that is called as glenoid cavity, which articulates with the head of the humerus to form the glenohumeral joint, or also called as the shoulder joint. And now just behind or at the ending of junction of your lateral border and the superior border, again there is a bent finger-like projection, that is called as the coracoid process. What is that called as? Coracoid process. There are two tubercles, one above the glenoid cavity and one below the glenoid cavity. They are called as supra and infraglenoid tubercles. The lateral end of the superior border at the root of the coracoid process shows a notch, that is called as suprascapular notch. Suprascapular notch, this one. Okay. So the dorsal surface of the spine divides the dorsal surface into two fossa, supraspinous fossa and infraspinous fossa. Supraspinous fossa and infraspinous fossa. Yes. What do you want?
I want to appear this previous point appear to near to the camera.
Yeah.
Previous point. Could you appear it near the camera?
Look, I am here to teach you not to. I am not here acting and you are shooting the video.
Okay, keep going. I'm so sorry.
Just take the bone and then later do it. So you have. So this is about the features on the scapula. What is that? Triangular bone, 3 angles, 3 borders, 2 surfaces, okay, and 3 processes: spine, acromial process, coracoid process, and you have a glenoid cavity and 2 tubercles, supraglenoid tubercle and infraglenoid tubercle. So dorsal surface by the spine is divided into 2 parts: supraspinous fossa, infraspinous fossa. Now we'll go to the what is that? Attachments. We'll go to the attachments. Okay. So that is the extension of the what is that? Scapula. I was explaining it from the 2nd to 7th rib. Yes. Now attachments here. When you look it from the costal side, a big muscle here on the costal surface, subscapularis. This all pink area is for subscapularis. What is this? Subscapularis muscle. Okay. And now very importantly, along the medial border. Along the medial border on the costal surface I am talking. Okay. You have insertion of a very big muscle. What is that? Which is known as the boxer's muscle. What is that? Which appears like a saw. Serratus anterior. Serratus anterior. Serratus anterior is attached on the costal surface of the medial border of the on the costal surface. Okay. So this big blue line. Okay. That is the serratus anterior. Serratus anterior. Okay. And now coming to the attachments of the coracoid process. What muscles? One of them I explained in the last lecture.
Muscles forward. Which muscle?
You tell me. No, trapeze is not to the coracoid process. One of the pectoralis. Which pectoralis? Minor. Only 2. If not major, then it is minor. So you have pectoralis minor attached to the coracoid process. Along with the pectoralis minor, 2 other muscles from the tip. Okay. Number 1, short head of biceps and coracobrachialis. What are they? Short head of biceps and coracobrachialis from the tip, and pectoralis minor on the again same on the lateral side. Okay. So pectoralis minor, coracobrachialis, and short head of biceps. Short head of biceps brachii. Okay. So these 3 muscles are attached on the coracoid process. I repeat: short head of biceps brachii, coracobrachialis, pectoralis minor. Okay. Now the acromion process. Acromion process, it shows the attachment of middle fibers of the deltoid. Middle fibers of the deltoid. Whereas anterior, not the full deltoid. Anterior fibers from the clavicle, posterior fibers from the spine of the clavicle. So acromion process, middle fibers of the deltoid. So this spine is having 2 borders, as I said, upper border and lower border. Upper border you can say the deltoid muscle, posterior fibers, and then trapezius. Trapezius and deltoid, posterior fibers of the deltoid over the spine. Over the spine. Okay. So now these 2 tubercles I said, supraglenoid and infraglenoid tubercles. Supraglenoid tubercle for long head of biceps brachii. Long head of biceps brachii. Infraglenoid tubercle for long head of triceps. Triceps brachii. Long head of biceps from supraglenoid. Long head of triceps from infraglenoid. Okay. And now coming to the dorsal surface. So supraspinous fossa, supraspinatus. Yes. Supraspinous fossa, supraspinatus. Infraspinous fossa, supraspinatus. Supra above the spine. Okay. And now below the spine, infraspinous fossa, infraspinatus. And now look at the lateral border. It's the lateral border. You have two muscles. You have two muscles. Teres minor and then teres major. Teres minor and teres major. Over the medial border, levator scapulae above the spine. This is the spine, okay? Above the spine, levator scapulae. Below the spine, rhomboides minor and rhomboides major. Am I clear? Whereas on the costal aspect, you have serratus anterior. On the dorsal aspect, above the spine, levator scapulae. Below the spine, two rhomboids, minor above and major below. Am I clear? So these are the muscle attachments on the scapula. Important muscles I said. So there are some other muscles like omohyoid, latissimus dorsi. Okay, latissimus dorsi especially on the inferior angle. Okay, small part only. And near the suprascapular fossa you have omohyoid, infrahyoid muscle, one of the infrahyoid muscle. Okay, neck muscle. You might have studied the omohyoid.
Yes.
Okay, that arises from the scapula or the suprascapular notch. So these are the muscles which are attached on the scapula. You want me to repeat? What are the muscle attachments? The costal surface. Yes. Can anyone please say? Just look at the picture and then tell me. Take the bone and show me. Stand up and even it will be helpful for your friends. Say it. No. Why? Yeah, you can do it. Anyone? At least give a try. Stand up and say. Look at the picture, try to locate that in the bone and say it louder. Yes, good. So now coming to the pectoral region, as we already discussed it, the same. So that's the anterior wall of the thorax or the chest, we say. So where you have the muscles. What muscles you find in the pectoral region? Pectoralis major. Okay, just immediately before reflecting the skin, and then the pectoral fascia which covers these muscles. You have pectoralis major, which takes origin from the medial half of the clavicle. Okay, then the lateral border of the sternum and the upper six ribs. Upper six ribs. That is the origin. And insertion going to the bicipital groove of the humerus, bicipital anterior line of or anterior lip of bicipital groove. Okay, so that is the insertion of the pectoralis major. So you find two nerves here in this region, medial and lateral pectoral nerves. They will be supplying the pectoralis major, and the arterial supply is by pectoral branch of thoracoacromial artery, pectoral branch of thoracoacromial artery, and the internal mammary artery branches. Okay, so nerve supply medial and lateral pectoral nerve. So then the action, it is a powerful adductor. It is a powerful adductor, adductor of the upper limb. Okay, and even it may cause medial rotation. No pushing. Pushing is serratus anterior. Medial rotation and as well as flexion. Am I clear? So that is the action of pectoralis major. Mainly adduction, not abduction. It is adduction, Okay, medial rotation and flexion. And when you cut this pectoralis major and reflect, you find this muscle, that is the pectoralis minor, deep to major, which originates from 3, 4, 5 ribs, especially at the junction with the costal cartilages. Okay, runs upwards and then inserted to the coracoid process, not coronoid. It is coracoid. Don't confuse between the words. There is other process called as coronoid. Okay. So this inserted into coracoid process of the scapula. The main action is depression. As it is going down and then upward, it depresses the scapula. Okay, and slide forward like protraction also. And now supplied by medial pectoral nerve. So mainly it gives protection to these structures, the vessels and nerves. Okay, and the third is the subclavius, right? From the first rib, okay, going to the subclavian groove of the clavicle. Subclavian groove of the clavicle. Then nerve supplied by nerve to subclavius. Mainly it stabilizes the clavicle. Okay, and even it pulls this little clavicle downwards. So that is the what is that action of the subclavius. Okay, so that is the three muscles: pectoralis major, minor, and subclavius. And even we studied, I guess, the serratus anterior also. Okay, so what is the serratus anterior? What is the origin of serratus anterior? Outer surface of
1 to 8 ribs.
up to 8 ribs, 1 to 8 ribs, or even sometimes 9 also. Okay, all the ribs, and then runs upwards close to the chest wall or the rib cage, and goes anterior to the scapula, and then inserted onto the medial border of the scapula along the costal surface. Okay, medial border, all the odd borders. Okay, so that is the insertion. So what is the nerve supply? So here, this is the insertion all along the medial border. Okay, so what is the action? The nerve supply. Nerve supply is by long thoracic nerve. What is that? Long thoracic nerve. What is the action? So that is the insertion. Action, it draws the scapula forwards, pushing and punching movements. Punching. So that's why it is called as boxer's muscle. What is muscle? Boxer's muscle. Yes. And even it helps in overhead abduction. That is abduction after 90 degrees. Along with trapezius. And nerve supply, I said, long thoracic nerve. Blood supply, lateral thoracic artery. This is the picture again showing the serratus anterior. See here, taking origin from the 8 or 9 ribs and going anterior to the scapula and inserting along the medial border. Okay? See how close it is with the rib cage. This is the scapula. So it's going anterior to the scapula along with the costal wall and then go to the medial border. Okay? The cut section picture of the thorax showing the serratus anterior. So a lesion of the long thoracic nerve will give rise to, yes, what is that? Winging of the scapula. Winging of the scapula is due to injury to the long thoracic nerve. This is the clinical condition arising out of paralysis of serratus anterior because of a lesion of injury to long thoracic nerve. What is that? Long thoracic nerve. So that's all about the pectoral region and the two bones, what is the scapula and clavicle. Okay, am I clear? Yeah. So there are some plastic models. It's very easy to, if you go sometimes, anytime if you go to lab, you can very clearly make out the pectoralis major, minor and serratus anterior model. Okay, because as they are big models, I could not get them.